Welcome everyone to today's webinar, Strategies for Success in Out-of-Network and Payer Reimbursement Management. I'm Morgan Havner with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters. John Bartis serves as the President and CEO of CollectRx. Mr. Bartis is a veteran in the field of healthcare and information technology. As President of Dr. First and Executive Vice President of Prematics, Dr. Bartis has specialized in providing cost containment services to health insurers and various products and services to hospitals, health systems, and other healthcare providers. Previously, Mr. Bartis was an attorney at Kirkpatrick & Lockhart, now K&L Gates, where his practice focused on litigation. Mr. Bartis has served a wide range of for-profit and not-for-profit health insurers, including Blue Cross Blue Shield of Florida, Humana, Capital Blue Cross, Kaiser Permanente of the Mid-Atlantic region, CareFirst, and Blue Cross Blue Shield of Massachusetts. He has also served numerous hospitals and health systems, including Henry Ford Health System and MedStar Health, along with hundreds of physician practices. Mr. Bartis is a graduate of Princeton University and has his JD from the American University Washington College of Law, where he graduated summa cum laude and was a member of Law Review. Rija Singh is the Executive Vice President of Sales at CollectRx. Ms. Singh has served in senior sales management positions for over 10 years. She was employed in the information technology field, first with Cisco Systems and then with Vocus, one of the nation's leading companies of public relations software. Her IT experience has provided her with key skills applicable to her current role at CollectRx. Ms. Singh also serves as account executive for Merrill Lynch. Having joined CollectRx in 2010, Ms. Singh now serves as CollectRx's Executive Vice President of Sales. Her responsibilities include developing and implementing corporate-wide sales and marketing strategies, sales management reporting and systems, overseeing the sales, marketing, account management staff and functions, and serving as lead relationship manager with several of the firm's largest clients. During her tenure at CollectRx, she has been instrumental in the firm growing its client base to more than 1,300 healthcare provider organizations located throughout the country. Ms. Singh holds a bachelor's degree in computer science from the University of Maryland, supplemented by certification programs in advanced training in sales management information systems. At this time, I am pleased to turn the floor over to Rija and John to begin today's presentation.
Thank you, Morgan. We appreciate it. And again, this is John Bartis, CEO of CollectRx. We appreciate you taking the time today to sit in on this webinar. It's entitled Strategies for Success in Out-of-Network and Payer Reimbursement Management. And we're excited to talk to you today about the current state of payer reimbursements and how you can manage both in-network and out-of-network to optimize your AR follow-up. So more specifically, I'm going to be speaking today about the issues and challenges providers face with respect to in-network and out-of-network collections, as well as the best practices or keys to success in managing them and maximizing your revenue. Our goal today when we're done is to provide you with the information you need to help you build a robust out-of-network and collection strategy and to familiarize yourself with what you need to know to be successful in doing so. But before I dive in and talk about those topics, let me provide you with sort of a quick summary of our experience in out-of-network and collections so you have an understanding of why we're in a position to address these issues. So despite our name, CollectRx has nothing to do with the pharmaceutical industry. Simply put, what we do here at CollectRx is we help providers get higher reimbursements on out-of-network bills and payer collections. We don't do this as consultants, but we do this as experts in negotiating and appealing to achieve higher reimbursements on your out-of-network bills and payer collections. We're focused on helping providers get higher reimbursements. We've been doing this for more than 10 years. Have 800 customers nationwide, process over $1 billion in claims each year. We service a variety of different types of providers, from hospitals to physician groups, surgery centers, labs, behavioral health, just to name a few. And there are really sort of two keys to our success. One key is what we call CRIXIS, which stands for CollectRx Information System. This is the data and analytics tool that we created here at CollectRx to help us as we go toe-to-toe with the payers. It provides us with the ability to analyze different insurance policies, has comparable data, and allows us to track tendencies and trends of the people on the insurance company side. The CRIXIS is coupled with our expertise that we've developed here. What we've done is we've built a unique team of experts who used to work for the insurance companies and their vendors, which puts us in a unique position to really understand the soft spots in their position and get higher payments on claims for our customers. So what are some of the issues that we see on a daily basis as we go up against the payers on behalf of our provider customers? Well, as providers look at the landscape today, there are fewer opportunities than ever before for providers to improve their revenue profile. In-network contracts are set with very little opportunity to move the needle. Medicare and Medicaid are literally immovable. Out-of-network really represents the last opportunity for many providers to improve their reimbursements and, as a result, their bottom line. However, without a strong understanding of the processes and procedures that need to be in place to maximize reimbursements, providers run the risk of spending time, effort, and energy with little reward. So what are the issues that are facing providers? Well, far away, the number one issue that providers face is the reduction in reimbursement. It's important to remember that the payers and the vendors that work for the payers are working constantly to reduce out-of-network reimbursements and to underpay claims. Today, payers are using a variety of tactics which allow them to reimburse providers at anywhere from 20 to 50% of billed charges. And there are three main methods that the insurance companies are using in an attempt to reduce reimbursements on these bills. One of those tactics is what we call bill-specific rate reduction tactics. Basically, what they're trying to do is reduce reimbursement rates on out-of-network bills, sort of one bill at a time, if you will. The vendors who work for the insurance companies to reduce out-of-network payments, companies that you may know such as Viant and Multiplan, each receive over 10 million out-of-network bills each year. And every time a new bill is received, they run computer algorithms to determine which of a couple of tactics will yield the lowest possible payment to the provider. One such tactic is to negotiate a settlement in exchange for the provider agreeing not to balance bill the patient for the discounted amount. So in other words, the insurance company tries to negotiate fees after services have been provided and after the patient has left the facility, but before the insurance company makes a payment. Typically, they fax a proposed settlement offer to you, oftentimes with a short turnaround time. A second tactic is simply to reprice the bill down to what they consider to be reasonable and customary, which is close to the Medicare rates. So in other words, the insurance company reprices the out-of-network bill down to 50% or less of billed charges based on their determination of what is reasonable and customary. The second tactic that the payers use to reduce payments is to offer what are called limited benefit policies to their clients. If you're not familiar with them, a limited benefit policy is one that puts restrictions on the calculation of reimbursements. Frequently, these policies tie benefits to a percentage of Medicare. It could be 100% of Medicare, 80% of Medicare, 120% of Medicare, or anywhere in between. So, for example, United Healthcare has what they call their MNRP policies, and Cigna has what they call their MRC policies. These are both examples of policies that are tied to a percentage of Medicare rates. And just to be clear, as you think about it, by accepting these patients, you're essentially accepting Medicare rates. Now, the good news is that you're typically able to negotiate higher and sometimes much higher than these Medicare rates would suggest. Another cost containment tactic that's increasingly being used by payers to reduce out-of-network reimbursements are what are called third-party rental network agreements, or silent PPOs. These include continuous discount agreements. Now, the third-party rental network agreements are agreements that are signed not within an individual payer, but with a third party that contracts with a number of payers, and they serve sort of as a middleman of sorts. They bring together payers and providers to participate in contracts that are often not very favorable from a provider perspective. Moreover, they are frequently offered to other payers in the network that the provider isn't even aware of, the so-called silent PPOs. At CollectRx, we have providers that ask us literally every day to review their proposed or existing contracts to evaluate them to see whether they should cancel them or continue with them. The most important thing to understand is who is the customer in these agreements. Just to be clear, it is not the patient, it is not the provider, it is the insurance company. And the reason this is important is that these folks aren't there to serve you, but rather they are the insurance companies looking for cost containment alternatives. Another example of these types of tactics is what are called narrow networks. Narrow networks are formed by payers by placing limitations on which providers can participate in a given network. This impacts not only outlying providers. In some markets, sort of the big providers in town are being left out of their narrow networks. So since by definition a narrow network means fewer providers that are in network, this means that there will result in there being more out-of-network care. Now, despite the efforts of these payers to reduce out-of-network reimbursements, the out-of-network market has grown to over $60 billion and continues to rise with no sign of slowing down. Out-of-network will continue to be an important part of the reimbursement landscape, in part due to the sustained growth of PPO enrollment, which has more than doubled as HMOs have declined. Now, from a payer perspective, the payers and the vendors, they know a lot about you. In addition to knowing about past negotiations, they know very specifically how they want to deal with your organization, and they put together the data to support their decisions. Their database, they're tracking every past negotiation, so when an out-of-network bill is input, a screen will pop up with the names, titles, and phone numbers of the folks in your business office. And, you know, that screen may say, don't go to Mary, she'll give you only a 30% discount. Go to Bill, he'll give you a 40% discount. These databases, they track the tendencies and trends of your staff, such as who has the authority to sign off on negotiation settlements, who gives the largest discounts and who to avoid, and how large a bill needs to be before they'll go to the administrator or the CFO. Finally, you know, sort of a 50-foot level point here is that much of the payer strategy is really built up around putting up roadblocks to convince you to give up and walk away. The process to appeal an underpayment and the expense associated with it, it's labor intensive, and they're counting on you to succumb to their roadblock strategy. In fact, we'll talk about this in a little bit, but the Office of the Inspector General had a study which showed that the average appeal cost is $1,200, which is not a small amount of money. Now let's discuss the keys to increasing out-of-network payments. The first key is specialized out-of-network expertise. It's critical to have a depth of knowledge about how out-of-network reimbursements work from the insurance company's perspective. For example, to be successful, it's important to know whether on a particular case it's better to write or make a phone call to the payer, what are the arguments that you want to make, what are the facts that you want to produce. You certainly should know and really understand your EOB. You need to know all these things and make a final determination whether you want to keep your appeal inside the payer or go to an outside body like the U.S. Department of Labor. The second key is to obtain data to prove that the insurance company's payments were inadequate. As I mentioned before, we have an incredible amount of comparable data because we're aggregating data and results from the more than 800 customers that we work with. We use the data and analytics to compare our determination of reasonable and customary along with the insurance company, and a lot of times we're able to identify holes in their data and convince them to make an additional payment. The third key is understanding the payer side incentives, both from a financial point of view as well as from the perspective of them keeping their customers happy. We leverage those incentives to help our providers as we go toe-to-toe with the payers. The fourth key to success is time and persistence. Handling out-of-network bills is a time-consuming task. On any given case, you may need to be writing multiple letters, making multiple phone calls, and it's one of a lot of tasks that you and your staff might be handling. It's a full-time job, but it's really worth it if you can spend the time and understand how to be successful. The fifth key is focus. While your team might be pulled in many directions by your Medicare, Medicaid, and in-network bills, dedicated focus on increasing reimbursements on out-of-network bills will pay off. And finally, the sixth key to success is healthcare reimbursement attorneys. From time to time, you may find it necessary to bring one in to help you as you put together your strategy. So let me turn the floor over to Richa. She'll discuss the various issues relating to payer collections. Richa?
All right, thanks so much, John. There's a lot of different issues that we've encountered that providers are facing today when it comes to their collections. Just things that we've analyzed after we follow up behind, their billing companies or in-house collections. And to start off with, 5 to 10% of revenue is lost while following up on AR because some providers just lack the time and the technology to follow up on unprocessed claims, missing documentation requests, and denials. So whether it's in-network, out-of-network, or Medicare, a lot of providers out there, they overlook claims that were not properly processed per the contract, by usual and customary, or by the fee schedule. So in this way, large amounts of money are also left on the table. Now, in terms of out-of-network claims, very generally, John just did a great job going through a thorough description of it, but generally 30 to 40% of revenue is lost on each out-of-network claim because of the lack of data, time, and expertise to properly maximize out-of-network reimbursement. Now, your billing system is made exactly for that, billing. It's just not robust enough in the majority of cases to handle the collections process. So most providers resort to organizing through spreadsheets, and then claims just slip through the cracks. And finally, just think about how are providers supposed to properly manage their revenue without proper reporting on KPIs or key performance indicators, staff productivity, and claim status. So all of these holes in collections, they can add up to a gigantic loss in revenue for providers. Another major issue that providers are running into today is the increase in denials and underpayments. This is a bigger issue for more than just out-of-network, as we've always discussed. It also includes Medicare, Medicaid, and even in-network. So I wanted to share some key statistics that we found. To start off with, U.S. Department of Labor, they say that around 14% of all submitted medical claims, they're rejected. Only 1% of Medicare Advantage denials are appealed, but of those that are, over 75% of them are successful. In 2017, the ACA plans, they denied 19% of in-network claims, but fewer than 200,000 of the almost 43 million denials were ever appealed. 10% of hospital claims are denied, but over 60% are thought to be recoverable. So, the reasons that are cited by providers for not appealing, well, it comes from, complexity of the appeals process, As John mentioned earlier, it's an estimated cost per claim to appeal of over $1,200, and simply it's just the lack of time. So now let's talk about what we call the keys to success for collections. And similar to OutofNetwork, what John was talking about, the first key is understanding payer tactics to reduce reimbursement. We briefly discussed this earlier, but just have to reiterate how important it is to be clear on how the payers operate and the tactics that payers use to reduce and delay payments like claim denials and documentation delays. Because if you can avoid these tactics early on, it'll help maximize your reimbursements and reduce your outstanding AR in the long run. Now, leveraging state-of-the-art technology is critical to success. So both data and automated workflow rules will help you gain higher reimbursements, and it'll ensure that you're not leaving money on the table as the payers utilize their own tactics to reduce your reimbursement. So in terms of workflow, automating manual processes such as scanning the payer websites, scrubbing your 835 data, and just ensuring that you understand every account in your AR to identify at-risk accounts faster will help yield significant results. Your processes, the automated processes, they should also reconcile every account from assignment to zero balance to make sure nothing slips through the cracks and that the correct payment is in the bank. For data, being able to analyze comparable claim level data and track the tendencies and trends of the insurance companies and their vendors is a huge lever in improving your reimbursement. Coding technology optimizes workflow so providers experience lower costs with reductions in turnaround times, denials, and accounts receivables. And based on OIG audit methodology and AHIMA's best practice standards, it should support accurate and compliant coding. And then finally, with the analytics, just being able to deep dive into the metrics is a critical component of strategic planning. Analytics and reporting allows you to evaluate payers, procedures, and payments in the aggregate, and it just simply provides the best insight to your revenue. Now, one of the strongest procedures to optimize revenue is in-depth reconciliation processes all throughout collections. This is the third key. Now, we found that there can be many missed opportunities which can lead to 5 to 10% missed revenue in AR follow-up alone. Putting multiple checks in place and using automated workflow tools will ensure that every single claim has been followed up on, has been processed by the insurance company, and that you actually have money in the bank. So this slide illustrates an example of a common mistake made by many providers. It's failing to reconcile billed claims to payment. In this example, the provider billed out 20 encounters. Now, 17 of them were actually successfully processed by the insurance company. The other 3 encounters, though, they were never processed, and they simply fell off the provider's radar. So now if each one of these encounters that were missed was worth $3,000, that will result in $9,000 of missed revenue just that day. Now think if this error occurred every day, it could result in $180,000 loss of revenue throughout the entire month. So the point here is that even missing only one charge per day, it can add up to significant dollars lost in the long term. The fourth key is workflow optimization, and routinely understanding workflow is critical because the most common issues on the back end of collections are caused by breakdowns in the early parts of the revenue cycle, so things like clinical denials or incorrect 837 data. So it's very critical to, every once in a while, sit down and dissect your workflow to identify weak links on the front end, and that way it's really going to help your cash flow and reduce your AR on the back end. The fifth key to success is data and analytics. The issue with any billing system is that it's limited to the canned reports that they provide. But it's imperative, however, that you determine how to analyze your data and do things like a root cause identification on your underpayments or your denials, how to identify trends, projections, revenue impact, and doing this on a weekly, monthly, or ad hoc basis is important to help you make more informed financial decisions quickly and manage the cost to collect. So having a flexible system that allows you to evaluate holistically will result in insights that can drive provider revenues. The 6 key is specialized out-of-network expertise. Again, John did a great job, describing how you can maximize reimbursements and some of the keys to it. But again, the opportunity to increase out-of-network payments is so great that it can have a tremendous impact on your bottom line. Because if you think about it, there just aren't a lot of other opportunities within different claim types to increase reimbursement rates. Because your contracted claims, your fee schedule rates, they're already fixed. Out-of-network, though, is really the only area left where you can increase rates and improve your bottom line. Collections key number 7. This is for if you're outsourcing your payer collections. You need to make sure that your partner is ProviderCentric. Because one of the biggest complaints we hear from providers is that they do not have access to their collections information. So you have to make sure that you're able to retrieve your own EOBs and collection reports so you can routinely audit your collections partner. Also, insist on weekly meetings with them because you need to ensure you're collectively hitting your KPIs, or again, your key performance indicators, and that you're troubleshooting the issues if you're not. And finally, there is key number 8, which is building stronger relationships with patients. Understanding that every interaction with patients is critical to you. Utilization of customized patient statements from most practice management systems can help to create a better patient experience. All right, so to summarize, a robust out-of-network and collections program has a number of tangible benefits to your organization and clients. First and most importantly, a program that leverages best practices will increase reimbursements and combat the decline in rates that we mentioned earlier. Secondly, it will allow you to optimize every transaction and ensure that you're getting the payments you're entitled to from payers. It'll also allow you to maximize cash to revenue, decrease collection costs, and reduce days outstanding. The data and analytics will allow you to improve processes upstream and help you manage your complex claims. And perhaps most importantly, it will improve patient experience as the payers become more accountable and they meet their obligations. So in sum, I hope you all have a better idea of what's happening today with respect to out-of-network and collections. Also, just remember that when done right, proper out-of-network reimbursement management and collections is one of the few ways that providers can help improve financial performance without having to see more encounters. So thank you all for your time today. Hope you guys found it useful. And Morgan, I guess we'll turn it back to you.
Thank you, Richa and John, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many questions as we have time for. We have a lot of great audience engagement going on right now, and it looks like an audience member is wondering, what is the single most effective thing I can do to increase my collections?
Richa, do you want to?
Okay, yeah, I can take that. The single most effective thing, I would say it's pretty similar to what we say with out-of-network, being persistent. Just in this case, it's more following, obviously, in collections for the AR follow-up processes. Early in my part of the presentation, I was talking about, that 5 to 10% of revenue is lost because it's just simply not properly followed up on. And insurance companies, they're always making it difficult to retrieve your money and delay adjudicating claims. And unfortunately, for some providers out there, claims can slip through the cracks if they keep getting delayed. And what happens is things like billing claims out or posting payments that actually did occur, those end up taking precedence because it's low-hanging fruit. So just make sure you're staying persistent and on top of every claim out there, basically.
Absolutely. Thanks for diving into that question. Another audience member is curious, is there any one payer I want to stay away from to improve my collections rate?
I'll take that one. So basically every single insurance company puts up roadblocks like John was talking about before, especially if you're out of network. I mean, they just all play the same games, right? That they are constantly requesting things like medical records from you. They're purposely underpaying you. And then when you actually submit those documents, they, say that they never received the medical records or they never received your appeal letter. So then you have to resubmit it and you have to do this multiple times. I mean, it's just a horrible game that continues to be played by every single insurance company out there. So just make sure you stay organized with every insurance company because, I mean, they're really out there to save themselves money.
Yeah, that's a great tip. Thanks for tackling that question, Richa. Another audience member is curious about how does a practice know when they have collected an acceptable amount on a given procedure?
Well, it really depends on the type of claim that you're talking about. If you're really focusing on in-network claims, the only way to know is to really focus on what your contract says. However, if you're talking about out-of-network claims, it's about knowing your data, and you need to be keeping track of your data, the results that you're having, in order to use that as comparable information as you, again, go fight the fight, so to speak, against the payers on these types of issues.
Right. Thanks for highlighting that distinction, John. And it looks like we have about a time for one more question today. And an audience member is curious about what kind of technology is the best for improving my collections? Does the 80-20 rule apply in the out-of-network collection space?
So the 80-20 rule, I would say, does apply. But if you're prioritizing and using technology and developing your workflow, automating processes, a lot of the things that Richa was describing for us previously, if you can do those types of things, you can definitely get closer to 100%.
And one more thing, I want to add one thing about the technology part of it. Automating processes across all parts of the revenue cycle is definitely best. The one place that we found, obviously, part of, or the reason of this webinar is, collections, is AR follow-up, because we see a lot of providers that use spreadsheets to organize their accounts receivable, but it can be really hard to track everything that's happening and to reconcile. As I was saying, that's one of the most important parts of collections. And again, billing systems, they're great for billing, but they're not built for robust collections and reporting. So I think that one part for technology on the back end during the follow-up is important. Because if you're able to automate the follow-up to identify at-risk accounts, then you get to spend more time fixing the issues, and that's what's going to result in more money for you instead of, finding the issues or trying to figure out what the issues are, which just ends up taking up your time.
Thank you both for clarifying those two questions. And before we close today, I want to ask Richa and Franklin, or John, do you have any final thoughts?
No, I think trying to get away from, more manual processes and putting it into automating is going to help in an overall collections, and then obviously just staying persistent with every single claim, whether it's out-of-network, in-network, Medicare, Medicaid. I mean, again, all these insurance companies are figuring out ways to save money. So you need to figure out how to keep that money from them, basically.
Yeah, and I think just to reiterate a point that we made during the presentation, and Richa actually just alluded to it now. I mean, a lot of this is dealing with the roadblocks that the payers are experts in creating, and you need to have that time and persistence to sort of fight back, if you will. Because if you don't do that, it makes it very difficult. But there are great rewards if you're able to do that.
Great. Thank you for your thoughts there. And that is all the time we have for today. So I want to thank Richa and John for their excellent presentation and CollectRx for sponsoring today's webinar. I hope you all enjoy the rest of your day, and we look forward to having you join us for future webinars.